All right, back with another episode of Better by the Numbers podcast, hosted by Life Metrics. We're here at the third annual Roundtable of Longevity Clinics with Ms. Ron and Dr. Corey. Guys, tell us what you're doing in the longevity space.
Well, the our objective in the longevity space is I guess first off to expand it, and both of us are plastic surgeons, and so we have a predilection towards the aesthetic industry, and we really hope to bring healthy longevity to the aesthetic industry as a part of a revolution and a rethinking of how the industry operates.
Perfect. Okay, guys. So, what are you guys doing I guess, what are you guys doing uniquely to position yourself in the longevity space for your specific practice? Because I was asking earlier, how many people are in your space that are coming into this one?
Yeah, very few. I think
Yeah.
this is revolutionary. I think that's the reality. I think one of the things that we've been walking the walk and talking the talk for a long time. I think in the space about how cosmetic surgery is not a point in time. It's about how it changes your life. We've talked about that. We talk about it all the time. I think what's changing now is trying to build out the physical facility, because you have to be able to deliver this care, right? Especially with the surgery part of it. It's not something you can do virtually, although there's lots you can do virtually. So I think the real, the way to really make the impact now is to build out that space. So we're building out that space that we think is going to build the community of people that are interested in what we do from a life perspective, not from a specific procedure or a specific issue. It's really about how it changes their lives.
Okay, so you're finding people who come into this, plastic surgery space, but more so for their longevity, because you're seeing that if they look better, they're going to live longer. Now, how do you find your ideal client?
There's a few different tracks to enter this path. Of course, there are people who will walk through our doors that are looking for healthy longevity, that will ask about, health metrics, that will ask about, systemic therapies. But we'll also have people who come through the door that are already coming through our doors looking for low-level treatments like injectables, fillers, Botox, neurotoxins, and things like that. Those are patients who the message they're giving us is, I care about myself. I want to be the best I can be. And so when they walk through the door while they're asking for that Botox, those patients are also people that we will be able to deliver a holistic type of care. And then, of course, then we also have surgical patients. And surgical patients, I think, are a very special opportunity, because those are patients who we are about to put through a really significant intervention, which has risk associated. And ultimately, the outcome is very dependent on the person, their status at the time that they have the surgery, and their aftercare. People often mistake surgery as an episodic thing, as Ron mentioned, and that means you come and you go, and you have a follow up to have some stitches taken out. But that's not really the case. Surgery needs to be thought of in a longitudinal fashion, getting people ready for their surgical journey and making sure that the surgical experience has the best recovery and the best outcome, and to maintain that over time. And so we're really looking at surgery as a membership. It's about taking care of yourself over a duration, and the surgery is one part of that as an episode in the middle. So we have a few different streams of patients that I think are going to come through our doors.
Nice. And if someone wants to come in and they just want a one-off, right? How do you tell them what are some of the most common negative side effects to longevity, specifically to people who are looking to do that? For example, if I'm coming in and I just want to get some fillers or whatever, how do you explain to someone that this might not be the best option for you?
Yeah. So, it's a work in progress for sure. Yeah. So we're going to probably we are going to try a lot of different things, right? And I think one of the nice things about healthy longevity and a lot of the things we're learning about and all the advancements we're making in this field is that people see and feel results. And now with the ability to look at metrics, you really see those changes. So we have to get patients to make that leap. And sometimes that involves, they might come in for a specific treatment, which makes perfect sense at that point in time, but we know that they want or need so much more than that. So we offer that to them as part of it, right? So maybe our filler patients, for example, have, red light treatments, with their filler treatment. So we're looking after their skin, their inflammation at the same time as we're looking after their contour. And maybe offering it as part of it is their introduction. We can't give it to them for free forever. Of course, that doesn't make sense. But we are going to have to offer things to patients to get them in to feel the difference and see the difference. And then the rest should take care of itself because we know it works, right? I mean, they won't see that they live a long time for a long time,
Right.
but they'll see how they feel. And now with all the biometrics and all the things that we can look at on a screen, they'll see those changes and hopefully stick with it. That's the hope.
So as someone gets older, they're going to be curious about this. They're going to look at themselves. They're going to want to feel better, look better. What is the number one advice would you give to someone who wants to take preventative measures before having to go see you guys?
The first thing that we tell patients is that true beauty comes from within, and we all know that healthy longevity is based on decisions that people make and how they live, and that's the same in the aesthetic industry. I mean, for people to really engage with their own aesthetic requires them to follow good sleeping patterns, healthy diet, appropriate movement and exercise, social connectivity and community. So the very pillars of healthy longevity are the same pillars that we'll speak about with patients, and getting people to understand that is an entry point, not just to their own health, but their own aesthetic. I think that gives people that tangible outcome so that they can recognize the impact that they can really have on themselves. And then that means that a patient is really going to change how they live. And that's the start to really living and enacting what we're talking about.
And I'll add to that, just for the patient that may be not quite as sophisticated or thoughtful about their general health, let's break down what it is that they're worried about. So before they need us, let's say,
Right.
as you're saying, what is it that bothers you? And you have to be able to drill that down. If you sit down, it could be that, some patients will just say, I'm starting to look old. Okay, well, what does that mean? Is it your hair? Is it your skin? Is it the way that your body moves or looks? And then try to think about, what are the things that we now know we can change to that specific area, right? We know, let's just talk about hair for a second. There's a whole field of hair health that there's a lot you can do for hair before you need a hair transplant. We do hair transplants, great, but you can come way before if your dad or your brother lost their hair early and you don't want that. So let's talk about hair health, and then we can talk about a transplant if you need it when you need it, right? But there's a lot you can do. So really understanding what that fear is or what people think is changing and trying to intervene the best we can, surgery or not surgery.
It's great. You guys, I wanted to get more personal, actually. How did you guys meet and realize that?
Ooh, that's a good story.
Yeah. How did you guys meet and realize that y'all shared this common ground?
Well,
this is my professor.
Oh, wow. Okay, great.
So I know I look older than him, but actually, Corey was my first professor, my first teacher in my first plastic surgery rotation, even though he was still young. And I just thought, like, this is like what I want to do. Like, it was a big part of it.
And Ron was one of the first residents that came through our teaching hospital when we had the teaching program develop, and I can tell you he was the best resident that I ever trained.
Wow.
And so we made a connection from that, and continued and recognized that we had a similar vision and a set of values on how we take care of people, both in terms of the quality and also the responsibility in what we do as plastic surgeons, and what we apply beyond just plastic surgery. Recognition of all that together, it meant that we have the same vision, and that's brought us together as partners.
Nice. All right. So you guys share the same vision. I want to know, what do you hope for? What do you hope to achieve in the next 10 years? I mean, it probably looks the same, but just want to ask if it's,
Yeah, I mean, I'm going to see if I could do that in one sentence, but in the end of the day, we want to change lives for the better. That it sounds a bit cliche, but it's been my vision from day one. And the question is, how do you execute that? And in plastic surgery, I thought I could get very close, but this piece, the longevity, the long-term wellness piece was missing. So I think that's what it is. If you can look back in 10 years and say, it's not that I did 5,000 surgeries or 10,000 breast augmentations, it's that I changed the lives of 5,000 people, that would be amazing.
Well, you know,
Feedback.
I'll follow up on that because I feel exactly the same. And beyond our impact on patients, I think that I'm really excited, and I think the next 10 years will bring our impact on our colleagues and our industry. Plastic surgeons in general historically have been leaders. The first kidney transplant, for example, was performed by a plastic surgeon, and you wouldn't normally think about that. But plastic surgeons have always been on the forefront and edge of medicine and healthcare, and so I think that we are in a unique position to be able to help pioneer a lot of these ideas. And so I think the next 10 years, we're going to see a true change and revolution in the aesthetic industry. And I really think that that will intersect and be a significant part of healthy longevity and how that industry develops as well.
Wow. Wow. Nice. Profound. I love it. Where can we find you guys?
So in Toronto, for sure. So come visit. We'll be open in April. That's the plan. Formfacebody.ca is our current website, and that's going to build and change and grow over time. And I don't know, you want my cell number?
Well, do you have
everybody else?
You guys
has
got
it.
social media at all?
Yeah.
Okay,
So
perfect.
Instagram also, Formfacebody, or Dr. Samoji, Dr. Goldberg.
Yeah, Dr. Corey Goldberg, MD, is my Instagram handle.
All right, Dr. Corey and Ron, thank you for joining us. That was the end of the Better by the Numbers podcast, presented by Life Metrics. We'll catch you on the next one. Thank you, guys.
Thank you.
Thank you.